7 warning signs of silent heart attack you should not ignore. When you think of a heart attack, you probably imagine someone clutching their chest and collapsing to the ground. However, a silent heart attack is much more insidious and difficult to detect. This type of attack does not produce any noticeable symptoms. Consequently, many people who experience a silent heart attack do not know until further testing reveals the truth. And how common is this? Well, out of an estimated 805,000 heart attacks each year in the US, 170,000 of them are silent. As it may go unnoticed, it can cause great damage, and without treatment, it can be deadly. However, there are some telltale signs that can indicate whether or not you are at risk for a silent heart attack. In today's video, we will share with you the top 7 warning signs of a silent heart attack you should not ignore. Number 1. Unusual fatigue. Unusual fatigue, often dismissed as a mundane consequence of a busy lifestyle or aging, can be a critical warning sign of a silent heart attack. This type of fatigue is characterized by an overwhelming sense of tiredness that persists even after minimal exertion and doesn't improve with rest. Unlike typical fatigue, which has clear causes such as lack of sleep or physical activity, this fatigue appears inexplicably and can be pervasive, affecting daily activities and overall quality of life. It often goes unrecognized as a symptom of heart trouble because it doesn't present with the classic, more alarming signs of a heart attack, like intense chest pain. Instead, the affected individual might feel persistently drained, with no apparent reason for their exhaustion. This can be especially concerning in women, who are more likely to experience subtle symptoms. The mechanism behind this unusual fatigue lies in the heart's compromised ability to pump blood effectively, reducing the oxygen supply to the body's tissues, which in turn causes a feeling of exhaustion. Moreover, the inflammation and stress responses triggered by a heart attack can also contribute to this sense of fatigue. Because it's so easily attributed to other less serious issues, this symptom is often overlooked until significant heart damage has already occurred. Therefore, recognizing unusual fatigue as a potential indicator of a silent heart attack is crucial, enabling timely medical intervention and potentially preventing a catastrophic cardiac event. Number 2. Mild discomfort in the chest. Mild discomfort in the chest is a subtle yet significant warning sign of a silent heart attack that is often underestimated. Unlike the dramatic and intense pain typically associated with a classic heart attack, this discomfort can manifest as a vague pressure, tightness, or a sense of fullness in the chest. It may feel like indigestion, heartburn, or even a pulled muscle, leading many to dismiss it as a minor ailment rather than a potential cardiac event. This mild discomfort can occur during physical activity or at rest, and it might come and go, making it even harder to pinpoint as a heart-related issue. The underlying cause is usually the same as in more obvious heart attacks: a reduction in blood flow to the heart muscle due to a blocked coronary artery. However, the body's response can be less intense, leading to these less dramatic symptoms. It's particularly important to pay attention to this kind of discomfort because it can easily be overlooked, especially in individuals with other risk factors for heart disease, such as diabetes or high blood pressure, where the nerves in the heart are less sensitive. This reduced sensitivity can prevent the typical severe pain from manifesting, masking the severity of the condition. Recognizing mild chest discomfort as a potential sign of a silent heart attack is crucial, as early detection and treatment can prevent extensive heart damage and reduce the risk of subsequent, more severe heart attacks. Understanding this symptom as a silent call for medical evaluation can ultimately save lives, underscoring the importance of not ignoring even the mildest chest discomfort. Number 3. Shortness of breath. Shortness of breath is a subtle yet telling sign of a silent heart attack that is frequently ignored or misattributed to non-cardiac causes. Unlike the dramatic chest pain typically associated with a heart attack, shortness of breath can present quietly, creeping into daily life without much fanfare. It may manifest during routine activities such as walking, climbing stairs, or even while resting. This symptom occurs because the heart is struggling to pump blood effectively, leading to a reduced oxygen supply to the body's tissues and an accumulation of fluid in the lungs. As a result, individuals may experience an unexplained difficulty in catching their breath, which can be easily mistaken for symptoms of aging, poor physical fitness, or respiratory conditions like asthma, or chronic obstructive pulmonary disease. Moreover, the insidious nature of this symptom means it often doesn't trigger immediate concern, especially if it occurs without the expected chest pain. In some cases, shortness of breath can be accompanied by other subtle signs such as mild chest discomfort, fatigue, or a feeling of lightheartedness, but these can also be overlooked or attributed to less serious health issues. The risk is particularly high in individuals with underlying conditions such as diabetes, where the typical warning signs of heart distress may be muted. Recognizing shortness of breath as a potential indicator of a silent heart attack is crucial. When this symptom arises without an obvious cause, and especially if it persists or worsens, it should prompt immediate medical evaluation. Early detection and intervention are key to preventing the severe consequences of undiagnosed heart issues, making awareness of this subtle symptom a lifesaver. Number 4. Dizziness or lightheadedness. Dizziness or lightheadedness is a frequently overlooked sign of a silent heart attack, often misinterpreted as a benign issue caused by dehydration, sudden movements, or even stress. However, this seemingly minor symptom can be a crucial indicator of an underlying cardiac event, demanding closer attention. When the heart struggles to pump blood efficiently due to a blockage or reduced blood flow, the brain may not receive an adequate supply of oxygen-rich blood, resulting in feelings of dizziness or lightheadedness. This sensation can range from a fleeting sense of imbalance to a more pronounced feeling of unsteadiness or even near fainting episodes. People experiencing this symptom might find themselves needing to sit or lie down suddenly to avoid passing out. What makes dizziness particularly deceptive is its non-specific nature. It can be associated with various other conditions, such as inner ear problems, low blood pressure, or anemia, leading many to dismiss it as insignificant. Additionally, in the context of a silent heart attack, dizziness often occurs without the dramatic chest pain typically associated with heart issues, further obscuring its seriousness. This symptom is especially concerning in individuals with risk factors for heart disease, including those with diabetes, high blood pressure, or a history of smoking, as these conditions can contribute to more subtle presentations of heart attacks. Recognizing dizziness or lightheadedness as a potential red flag for a silent heart attack is essential for timely medical intervention. If this symptom appears suddenly, without a clear cause, or in conjunction with other subtle signs like unusual fatigue, mild chest discomfort, or shortness of breath, it should prompt immediate medical evaluation. Early diagnosis and treatment are vital to preventing the progression of heart damage and reducing the risk of more severe cardiovascular events, making awareness of this subtle symptom critical for maintaining heart health. Number 5. Vomiting. Vomiting can be a deceptive sign of a silent heart attack, often mistaken for gastrointestinal issues such as food poisoning, stomach flu, or indigestion. This symptom, when accompanied by nausea, can lead individuals to overlook the possibility of a cardiac event. During a heart attack, the body's autonomic nervous system may react to heart distress by inducing nausea and vomiting. Unlike the classic, severe chest pain commonly associated with heart attacks, vomiting as a symptom can occur with minimal or mild chest discomfort, making it easy to dismiss. It can be particularly prevalent in women who are more likely to experience atypical heart attack symptoms. The critical context is recognizing vomiting in conjunction with other subtle signs like unusual fatigue, shortness of breath, or dizziness. When these symptoms appear suddenly and without an obvious cause, they warrant immediate medical attention. Recognizing vomiting as a potential indicator of a silent heart attack is crucial for early detection and timely intervention, which can significantly improve outcomes and prevent severe heart damage. Number 6. Flu-like symptoms, such as mild fever, chills, body aches, and fatigue, can be misleading indicators of a silent heart attack. These symptoms are often mistaken for a common viral infection, leading individuals to ignore or self-treat them without realizing the underlying cardiac issue. The body's inflammatory response to a heart attack can produce these flu-like sensations, which lack the dramatic chest pain typically associated with heart attacks. This subtle presentation is particularly common in older adults and women who are more likely to experience atypical symptoms. Recognizing flu-like symptoms as potential signs of a silent heart attack is crucial, especially if they are accompanied by other subtle indicators such as shortness of breath, dizziness, or unusual fatigue. Immediate medical attention is essential when these symptoms arise without a clear cause, as early detection and treatment can prevent extensive heart damage and improve overall outcomes. Number 7. Sleep disturbances. Sleep disturbances can be an overlooked sign of a silent heart attack, manifesting as difficulty falling asleep, frequent awakenings during the night, or restlessness. These disruptions are often attributed to stress, anxiety, or poor sleep hygiene, rather than underlying cardiac issues. However, the connection between sleep and heart health is significant. A heart under distress may impact sleep patterns due to reduced blood flow and oxygen supply. This can cause discomfort, leading to disrupted sleep. Individuals experiencing unexplained sleep disturbances, especially when coupled with other subtle symptoms like unusual fatigue, mild chest discomfort, or shortness of breath, should consider the possibility of a silent heart attack. Ignoring these signs can delay critical medical intervention, increasing the risk of severe heart damage. Recognizing sleep disturbances as a potential warning signal is crucial for early diagnosis and treatment, which can significantly improve outcomes and safeguard heart health. If you experience any signs or symptoms, and you're not sure if it is anything to worry about, it is best to consult your physician and not take any risks. If you think you have experienced the symptoms of a heart attack, you must get help fast. Even if it does not seem like a big deal at first, it could save your life. Do you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy.